As more jurisdictions in the country lock down, and most for a third time, and schools in many provinces like Quebec and Ontario closed yet again, we are left wondering what the way out of this will look like. Well, for researchers at Stanford University in California, they have developed a potential game changer, a platform for a rapid PCR test that fits in the palm of your hand and can give you a result with 99% accuracy in 30 minutes. And the FDA in the US just approved it for use. So what impact will a test like this have on the reopening of our economy, on everyday life? Will Canada approve this test as well? Well, joining me now to discuss this new test is David Robinson, Executive Director of Techknowledgey Group. David, thank you so much for joining me. I was really excited when I heard about this test. Again, this is going to be quite the game changer potentially for Canada. But first, please tell me about this test and why it's so different than everything else on the market right now.
Well, Tanya, I appreciate the opportunity to give you and your viewers a fast skate over the surface of an iceberg of detailed information here. This is what you get when you take some of the smartest medical minds on the planet, give them 7 years and $300 million. So what this is a PCR test. Very important. It's not an antigen test. This is a PCR test. This is as similar to the days when they took an IBM mainframe computer and shrunk it down to a personal computer. A hospital laboratory PCR system, a multi-million-dollar system, has been shrunk down to the size of a deck of cards in the palm of your hand, and it can give anyone, anywhere, a PCR. In this particular case, it's for COVID-19, result in 30 minutes. What's important to understand is the test platform that I'm showing you here is capable of testing for any infectious disease pathogen. This particular version of it happens to be for COVID-19. The first versions that were developed long before COVID came along were actually for STDs. So you can actually have this type of testing for all kinds of different pathogens. So the COVID-19 version that I'm showing you here was approved by the FDA in February 2021 for point of care use, which means that any nurse, any trained operator or physician could use this throughout the US. Early adopters of this are the NBA Basketball League, the US Department of Defense. You can currently be tested at LAX Airport, Terminal 6 with Clarity Labs, tested just a few hours before your flight with a PCR test. Also, hospitals are using this to test parents going in to visit their children in cancer care.
Wow. So this clearly has, can I say, rapidly changed things? Excuse the pun. So for the hospital level test, in Canada, we're used to, if you're going for a test, you have to book it online, sometimes days in advance, sometimes long waits, sometimes not so long waits. But, for the most part, it's been kind of, a bumpy road, shall we say. The technology there in the hospital, how much does something like that, the testing capacity at a hospital, if they want the larger geared up version of this, how much would something like that cost?
Well, it depends on the size, but there's lots of manufacturers that make large hospital PCR systems. It's in the millions of dollars. Has to be run by technicians, also uses specialized reagents and specialized parts. So you have some supply chain challenges,
right,
which we've seen happen during the pandemic where there was a shortage of certain reagents. There's also what we call instrument-based point of care PCR systems. And you might be familiar with the Abbott ID Now system, or in Canada, they had a product called the Spartan system. Unfortunately, they recently went into creditor protection with some deficiencies in their testing technology. These are small instruments about the size of a toaster that might cost in the range of, say, $20,000, run by a technician. They use some specialized parts. They're also capable of being done at the point of care. So they're good, but you can often only do one test in an hour or one test in half an hour. So they're not particularly scalable. And again, you need a technician, they're expensive, and they have some dependencies on supply chain.
Whereas this one, so how much would this test hit the market for? Again, it's not available for public consumption yet, maybe, perhaps in the future in the United States. We'll see what happens in Canada in a moment. But so how much would this testing kit cost, or this device?
Well, it is actually commercially available in the United States right now. They're manufacturing around 50 to 100,000 units a month. Price range is around $200 US at this point. And this product has been designed to be an over-the-counter product. So with the appropriate regulatory approvals, which take some time, you can expect it to be over-the-counter before the end of 2021.